and I'm just going to give a short introduction, what it is, where it's come from, and why does it matter, and why do we talk about it. So, contrary to a belief that many people hold, it's not to do with apprenticeships. It is about work experience. So it is a work experience program that was created in 2014 and has been running by really in the large accountancy firms, so the Big Four and also the National Audit Office and many other corporate businesses. And it's a really powerful, I think, attempt at making sure that there is equity of access to the accountancy profession, and to make sure that those who might not be normally getting access to work experience in accountancy do get that. And I think it's really, really important for that reason. It links into a lot of diversity and inclusion work streams that we have. So it is really about social mobility and supporting social mobility. And I was very, very fortunate to have many colleagues to support me in the East of England when I introduced this in, I want to say 2021, so like 4 years ago. And you might say, how does it differ from other work experience? So it is a program that is set for a week, and it comes with a number of conditions. And Access Accountancy, the parties that support it, are called the signatories or the supporters, are also signing up to working on data collection and supporting research, because really the ultimate aim is that over years to be able to track the benefits and track that cohort of students in order to be able to prove that social mobility can be supported by this program, and to just get more insights into social mobility and what are the maybe the hindrances to individuals. And Access Accountancy is therefore a charity really, and funded by the signatories. And we've been very, very, very lucky, and I think Jane Paling is on the call here, who's been pushing for that to be funded for the entire NHS, which we now have, and hence we're talking about it now. So there is no funding issue or hurdle, shall we say. So anybody now can just sign up and introduce this in their own organization, being mindful of there is this request to collect data on the students. But again, all of that information is only shared on a voluntary basis. I would say, you might say, so who is it for particularly? So if I were to summarize it, it is for individuals who are between 16 and 18 years old, who are at state school, whose parents haven't achieved degree level education at the point at which the student would like to have work experience. It doesn't have many other requirements, because the entire point is to not have hurdles, to not stop people from accessing it. And the aim, as I said, is to really be able to provide access to the accountancy profession to individuals that might not have that if they don't have family or friends already working in accountancy. And if I say a little bit about my own personal reflections before my colleagues talk about what they're currently live doing, introduced this in North and Waveney. I did this at the Queen Elizabeth Hospital, and I've had wonderful support from the Norfolk and Norwich, and I think here with Daryl today, and also NWAFT, so North West Anglia Foundation Trust, and then NHS England in the region. And we've had several cohorts of students, and it's a really powerful, I think, really powerful feedback. And I remember one young man in King's Lynn who said, well, I've been told that we feel left behind, I think, and he said, I've been told by a careers advisor I could never become an accountant because without moving to London or something like that. And I said, well, we're here, we run a large hospital and we have accountants and we train people. So I'm so glad you've joined us for this. So it's really giving perspective to individuals that the NHS, is a career, has a finance career, and not everybody realizes that. And I think for my own teams, found it really, really, and I hope Daryl and Rowan will share with that, found it really, really rewarding, because it gives us a platform to share the really important work we do for patients and enabling others to do really great stuff. And it's been an all-round win-win scenario where people really felt very enthused about the work they do and being able to share the value they add. So I'll probably stop at this point, but I'm sure at the end we have lots of time for questions.
Now, are you going to go next?
Yes, because if not, I'll be put to shame by the fact that you've got a presentation I haven't.
Only because I'm rubbish at remembering stuff.
So, hi everyone. I'm Darryl Chapman. I'm Deputy Director of Finance at Norfolk and Norwich in Norfolk. And as Laura said, we were kind of very lucky to have Laura as a driving force for this in the system, the region, and now nationally as well. We didn't have much choice, which is a great thing. So, I suppose reiterating some of the things that Laura has said. Talked about the idea of the scheme. It's not particularly different to what you might already be running as a work experience week for young adults. So Laura's talked about the age requirements. The important thing is that we're trying to expand our reach into those social economic groups who wouldn't necessarily think that a career in finance is something for them. So we've been doing this now for a few years. We're just in the process of doing it again for this coming year, so end of the academic year coming up. As I said, we don't do normal work experience now. We only do access accountancy for our work experience. Really important that we've made it as simple as possible to access. So our application process is an MS Forms form. Effectively, do you meet the kind of the age and study criteria? And then do you meet one of the two socioeconomic questions? So one around parents and degree level of education, the one around access to school meals in the last 6 years, I think it is. And then tell us about yourself in like one paragraph and why have you applied in one paragraph. So we want to make this as accessible as possible. And then we send this out to all of our local school contacts that our HR department and development department have got. We advertise it on the regional website, we advertise it on our social media, we share it across the system. So we're really fortunate to have an active system around development of our staff. So we share it with the other organisations who aren't able to do the access accountancy scheme in a particular year. So they share it as well. In terms of the more practical sides of it, last year we had 5 candidates apply. 2 weren't eligible. So you will find this, that we've had someone from a private school apply, and as much as you kind of want to say yes to everyone, we want to make sure that the people who do actually turn up feel comfortable and on a level playing ground. So we kind of made sure we applied the criteria rigidly. So we had 3 candidates who were successful. 1 pulled out rather late on, and I think Lorraine will mention this as well, that you have to be flexible. This is a voluntary scheme for the young adults as well. So they might not necessarily follow through on their commitment. They might find a job, etc. We kept the day, so it's for a week. We had it for a week. 2 candidates. We got them to sit with the main team. So we've got a floor here that's got about 30 or 40 people on it. So it's quite daunting when you first turn up. So we've got an area of hot desks that we kind of protected for them, so they had a bit of a quiet area, but they could still get a feel for what it's like to be in an office environment, because it's something new for them. We tried to keep the hours short because it can be very tiring when you're in a new environment. So it's only 9 o'clock in the morning to 3 o'clock in the afternoon. We gave them an hour for lunch, so it kind of mirrored what they probably were doing within their study previously. And one of the main things we did, so we did introduction to the NHS, we did all those sorts of background things, because you forget that people don't know all about the NHS and how complex it is. We introduced our trust, and again, people who aren't within the NHS don't understand how an acute hospital works compared to primary care, compared to other sectors. Again, very lucky, we arranged sessions with, so I know there's been a name check for Jane Paling already, but Jane did a presentation to the young students, young adults. That's really appreciated. We also set up sessions with our mental health trust in the area, with our community trust in the area, and with the ICB. So they weren't just listening to us from 9 till 3 every day. We made sure they had access to our intranet. So if there was any downtime, they could go and look at policies, accounts, go and look at our comms page just to see what goes on. It's a normal world of normal things happening. We were lucky enough that the timing linked in that we had an away morning for the whole team, and they got to come along to that. I say lucky, it might have been quite daunting, the fact that they had to sit in a room and sit at a table and engage. But speaking to them afterwards, they said that's very helpful. And they got a chance to speak to different people who hadn't spoken to during the course of the week. the reflection, and Laura said about this, about what you get out of it, a reminder of where people come from. So we had two very different young adults join us. One was very confident, always asking questions, would hang around at lunchtime and carry on talking and ask things. The other one was very quiet, and it was only about halfway through the week that I was talking to her and trying to get her to chat. And she mentioned she'd only been in the country for a couple of years and hadn't actually spoken English before she got into the country. So she was a refugee from Afghanistan, completely in awe of the fact that she was completing her A levels, hadn't previously spoken the language, had put herself forward for the Access Accountancy scheme, and had come along, and we were talking finance gobbledygook to her. But it really helped in terms of reminding us that we need to speak in a normal language that people can understand. But also the fact that you need to make sure you're treating the people individually, because they will be coming from completely different backgrounds, completely different levels of knowledge, not just around finance, the NHS, but also around how we work as a culture in the UK. So there can be a bit of work involved in engaging people in the conversation, but please do work at it, because that's the most important bit and the most rewarding part as a host. Really positive at the end of it. Both of them said, I had no idea that, first of all, I had no idea that finance was a career in NHS, because everyone always thinks it's clinical or medical. No idea of the complexities and the variety of jobs that are available. And both were thinking, actually, this might be something for me to do in the future. So very interesting to see what happens with the stuff that Laura talked about in terms of gathering data to see what happens to these young adults as they progress through their careers. I would finally say just a couple of pointers in terms of preparing for it. So do everything as early as you can. So plan everything early. Have a timetable in place. Make sure you share it with the candidates as soon as they turn up, so they know what to expect, because it is very daunting when you turn up to an office full of professionals. Be prepared to be flexible. So they might turn up late, they might have to leave early. There might be all sorts of reasons why something might not happen as planned. Just go with it. These aren't employees. These are people that we're trying to introduce to a gateway into finance within the NHS. So do everything you can to make them feel comfortable. Make sure you've got more time than you think you need. So you've got time to explain, you've got time to answer questions, time to have those informal conversations. So, you've got a timetable talking about financial transactions, so financial services, but make sure you've got a bit of time to talk about, well, what did you used to do? Where did you go to school? So they get to realise that we're all just, it's hard to believe we're all youngsters at one point, and have been through the same journey as some of them potentially. So make sure you've got plenty of time to have that kind of informal conversation with them. Make sure they feel comfortable and safe. Again, it can be quite overwhelming. Either make sure you yourself are available to keep on checking with them, or give them a buddy that they can sit close to, or sits close to their area. So they've got someone to go and ask questions if anything comes up during the course of the day. And then the final thing is, when you speak to people who've got no idea what finance is or the NHS is, it actually gives you a bit of reflection that you don't necessarily build into your day, and you actually realise what a great job it is we do and how important it is. So not just is it rewarding speaking to youngsters and hopefully giving them an appetite for coming into a career in finance within the NHS, but it also is quite rewarding just to take a step back and look at what you do. So I will pause there. Lorraine's much more organised than me, so she won't waffle as much. And I'm sure we'll take questions at the end. Sophie, yeah, okay. Lorraine, over to you.
Thanks, Daryl. Well, you covered most of it, so that's good. Hi, I'm Lorraine Bromley-Martin. I'm the engagement manager for Zoe Pietschark in the East of England NHS England team. I was introduced to Access Accountancy via Laura and her amazing promotion of it within the region, and just was inspired to get involved. It took me a couple of years to actually put on the week. So you do have to sort of gather yourself, make sure you've got the right connections. The thing that I found, sorry, can we move a slide on, please, Sophie? Thank you. And again, please, thank you. The barrier I had was actually not having links to schools, and I'm not in the area in the sort of vicinity where people can travel to the office for us. Obviously, being a regulator, we're not as sexy as trusts. We don't have more sort of in sort of exciting areas like around the hospitals and places. We are the regulator, so we're, as I say, not as sexy as the trusts have, or as many areas of finance. Obviously, we don't have the sort of income staff, but we were keen, and I had executive buy-in, so I was very keen for us to get this off the ground. And actually, I looked wider than just finance and the links to finance. So when I created the timetable, I mean, it's evolved over time. This is our 3rd year going into it. And I took advice as well, and the feedback from our 1st year students. So we had the will, we had the buy-in, we had the approval. I was given the time. As I said, it took me 18 months maybe to get this off the ground and open it up. But the barrier for me was not knowing who to speak to in terms of the schools and colleges, the local authorities, and I've had to build that up. This year, I've had exceptional support in that regard, because whilst Jane Paley has helped me over time and tried to link me in, I've now been in touch with Julia Schumann-Pratt at CUH, and it's her job to engage with schools and colleges in the region, and particularly in Cambridge and Peterborough. So Julia's been able to promote it widely, literally to the correct people in the schools, in the areas. So so we've had more interest this year. So it builds up over time. So don't beat yourself up if you don't get too many applications in the 1st year. Can we move on a slide, please, Sophie? Thank you. In our 1st year, we had 3 students, not many applications, and they all applied last minute. So I was thinking, oh my God, there's going to be no one. I'm going to be talking to myself. I've engaged all these senior people. What am I doing? But anyway, so dates that work. The 1st year we did it in November, which probably was the wrong time, which is probably why we didn't get so many people. We worked with the schools to work out when that might be better suited. So July is when we go now. It has to work for the team as well, because obviously they're doing the doing during the month end, and you know, all of that. So it has to be after certain dates for the team to be able to be available. Don't do it on your own. Get people to help you. We've got students that helped pull papers, like policies together, that they, you know, the data protection and all of those things. So you don't, you know, it's usually already available to you. You just have to pull it down and make sure it works for the current year. So don't do it on your own is my advice. Reach out to your Finance Academy link, because Jane's been fantastic in supporting us, and does come in on the week and gives psychometric tests, provides some updates on the Insights programme and what's available in the region in terms of placements and apprenticeships. So that's really helpful to the level of students that come in. Daryl's quite right, they're all different. Sorry, the dog's about to bark. The students in the 1st year was by day 2 they were speaking, which is always good. But day 2 they met Zoe, our director, and they gave her a grilling for 90 minutes, literally. Well, how did you get that job? How long will it take me to get that job? And actually on day 1, someone was following them down to take them to Tesco's, and every single one of them wanted to be in the city, basically. So by day 3 or 4, they're like, oh, I'd shown them the, you know, the pay conditions, the annual leave that we get, the flexibility we're afforded, the agenda for change pay scales. I explained to them about we'll pay for you to study. You don't have to go and get a really expensive education in uni. Come and work with us, get a salary, have flexible working, and start on 27 days annual leave, and we'll pay for you to get your qualification. Like, this is big stuff. Like, if you don't have anyone in your organisation, in your family, that's gone to uni or distant, to have a paid qualification that can take you anywhere in the world, really, it's quite a big thing. So don't forget to tell them about those things. So you do have to do your safeguarding. There's something called Unifrog that the schools and colleges use, and it's to do with the buy-in from the students, the school or college, and then the family. So they all have to sign up, and it's outlined what's involved, and then you give a précis of what they'll be doing. Year 1 and year 2, we've done 5 days at NHS England. Can we move on one, please? Sorry, thanks, Sophie. So onboarding, be patient, give them as much information you can before they start. So like an induction document so that they know. I gave them all the bus timetables, how to get there. If they needed a train booking, I could book a train ticket. The cost to us is reasonable expenses, so I can't pay them afterwards for a train ticket, but I can book it in advance through our process. But you might have petty cash that you can do that for them. We buy them lunch. So for us, we can, in our organisation, we can walk to Tesco. So we buy them a gift voucher for £5 a day. So that's however many students, £5 a day, but you might have your own in-house catering or something locally. Do the induction on day 1. So the fire drill, things like where the lilies are. You don't have to put your hand up. You can just go. Be courteous. The first time I gave them access to the TV to look at the different King's Fund slides and how money flows in the NHS and down from Department of Health through the NHS and through us and through the ICBs and onto the trusts. But I left them to it for lunch, and they would come back looking at YouTube videos. So you have to be a little bit savvy that they are students. So just keep checking on them and make sure it's appropriate access that they're having. So safeguarding, you take that very carefully. The parental consent for photos. So most of them didn't know what LinkedIn was. And I thought this was a really good start for them to have a profile, and all the people that they met, they linked in to those people. So that's Zoe, and she's got amazing connections. So then they build a profile to start with that just gets them seen a little bit. And then in the world of networking and business. So that was good, but you have to get parental consent for them for you to use photos to promote it on the LinkedIn page for them to then connect with you. So that's just important. And they are students. Daryl's right, they do get tired. I'm 9:30 to 4:30, and they do get an hour most of the time for lunch. But I do like to keep them busy. The one thing that shocked me last year, because in the first year everyone turned up, we had 4 people start. Only one of the lads came every day. So I was a bit disheartened. And on one day I'd had the director of Workforce Training Education sitting there, and I'd had all these people say, I'm not coming for various reasons. And I'm sure they're legitimate, but it's just disappointing. So I let Phil know that it was just going to be this lad, but I would be accompanying him. And he walked in, and I thought he was going to be a bit annoyed with me. He walked in, he strode in, he gave him his hand and said, you've made the right decision today. And I thought, wow, we are well supported in our region, and this is a senior guy. And he was like, if you or your family want to talk to me about jobs in the NHS, my door's always open. So so just look wider. It's not just finance. Workforce training education, very important to our work in finance. We do feedback forms so that we can learn and grow. So one of the feedback, we're still working on this bit, is actual work experience, doing the work. So what we find is it's very difficult in finance. It's live documents, it's the ledger. We can't let them loose on that. But this year, I think we're going to do a data dump of data and then get some figures in and then get them to create something. So the feedback that we had was we're not actually doing the work, which is quite correct. They can't really, but we are working on that. So have a think about that. Also, we got them to rate the sessions. So we only now put on the ones that are really popular. So supply chain procurement, they love that. They see the vans on the road. They don't know what's happening. And all the hospitals ordered different sheets and bedding and paper towels and everything else. So all of those things, we do something about the cost of items. We do this in the school's careers fairs. So can you put them in order of how much you think this theatre light costs, or this theatre bed against this ward bed, etc., etc. And they're blown away by some of these things that they are one-use things as well. So just think about different things that might interest them. We start with the King's Fund and One NHS Finance and HMA Finance information so that they can understand the basic premise of NHS. I came from corporate, so it blew my mind that NHS wasn't just one organisation. I had no idea. It blows your mind, the NHS finance, but it is a brilliant career, and it's well supported, and particularly in our region. I think we're a fantastic region and particularly supported. This year, I was contacted by a couple of organisations in the region that wanted to get this off the ground for themselves, but didn't know how, weren't sure. So we're doing it together. So it's 5 days in July. I've got the first 2 days. The second 2 days is at Addenbrooke's CUH, which is quite a sexy organisation. On the Friday, they're going to Royal Patworth, which is very interesting and very highbrow with all the heart stuff. And they've got an auditorium to give their presentation. So each year we've given them the challenge as they start. I don't tell them in advance. Day 1, day 5, you're going to be giving us a presentation about what you've learned. And I think they're a bit daunted to start with, but they really get into it. So all the bit, I'm like, take the notes, start your process early, work on it together, and make sure that if you've got an interesting fact or a big number, include it. So can we just move on one, please? Thanks. Thanks. So they have to give a presentation at the end of the week. And last year, 2 of them gave the presentation. And even though there'd been not so many people all week, we got people who they've met during the week, plus different people from the finance team. Unlikely to get them in on a Friday afternoon, but they did it. They came in and we got this presentation, and they gave us a quiz at the end of the presentation and said, were you listening? What did you learn from us? Which was amazing. So I felt like we'd done our job really well. So that's kind of a nice thing to do. We've had 40 applications outside of our region, which I can't accept. We can't accept applications outside of our region. So please do sign up. I'm very happy to help you. You can have all of my stuff, all of my forms, all of my timetables. You can have my time. I'll come along. I do go along to all of the sessions with all of the students because of the safeguarding aspect, just to make sure that they're okay and safe. Getting them outside of our organisation is tricky because we're so remote, pretty much in the middle of Cambridge, but not quite. So last year we walked them over to CPFT, which is the Mental Health Trust, and I gave them. So they had lunch with the Director of Finance, and they met some people on site about their state, because obviously it's very different on a mental health on a mental health space. So so just mixed it up a bit. What they really liked, and this has been highly rated, is the capital. So learning about the NHS capital, the amount of money that's involved. The 40 hospitals, not really. It's a toilet in a disabled area. It's it's not really 40 hospitals, but talking them through those things where they hear the headlines, but they don't know about what that actually means. So that's quite good. Nick Taylor's brilliant at talking them through that. Jason Donovan is just so motivating. So we give him an hour and a half to talk them through what NHS Finance can do for you. He's really motivating, actually. So try and find those people in your teams. Personal stories, career journeys, get them to talk, give you feedback, and maybe ask them to share their experiences at school. That's always quite good. As I say, they wanted to be investment bankers, but then by the end they were interested in NHS Finance. If we can grow our own, that would be amazing. We're very lucky in our region. So Jane coordinates the recruitment for apprenticeships and insights placements, and we have our own apprenticeship this year. So he's coming along to talk about his application process, what he's learned, what he's already passed his first tax exam. He only started last year, so that's fantastic. And definitely talk about the pay and benefits, because I think they're surprised at the salaries and what Zoe was earning. Well, I didn't exactly tell them what she was earning, but I was sort of alluding to the pay bands. And can we move on, please, Sophie? Thank you. So this is the first 2 days of our a work experience week this week. I don't have the other organisations' timetable yet, but you can see it's the supply chain, as I mentioned, the capital finance, King's Fund, Obviously, I'll do the induction on day one. We've got Jason, we've got the psychometric test, career journey from Zoe, insights placements and the apprenticeship. We'll try and squeeze some other stuff in there as well, as and when we get a bit closer. I've got 8 confirmed students this year, which is amazing. Didn't have that many. They're from all of the systems, so all systems pretty much are covered. Last year, all of the students came from one school because they didn't have many connections, and none of them knew each other before they came, so that was quite good for them too. Can we move on, please, Sophie? Thank you. Sorry, I know I'm rambling. Another. Oh no. No, that's the end. Brilliant. Okay, that's fine. Thank you. So just, I'm Lorraine. If you want to know anything else, or if you think I can benefit you bringing this to your own organisation, NHS England at the moment is the only we're the only organisation offering placements as a region. We're the only region at the moment for NHS England. So if I can help other regions, you know, please do get in touch, and I'm happy to help. Yeah, I'll share the application form. Everyone does their own, but it's a pretty standard. Yeah, I'll send the link to that. Please don't apply. But yeah, anything you want, I can share. That's me, I think, Sophie.
Fantastic. Thank you, all 3 of you. Do we have any questions from anyone? Say what a great feeder this is for the Insights Placement Scheme as well, to give people a real taster before they apply for it. So it's I think it's really, really beneficial. It'd be fantastic if more organisations could start to think about setting this up across their ICSs or in their own organisations, you know, whatever works best for the organisations. I will just put a link in the chat, which is all about Access Accountancy. Also, you do have to log in to see this page, because Access Accountancy have got a work experience toolkit, so lots of hints and tips and guides and stuff on what you can do, but they only want it to be access to signatories, which is why it's you have to log into our website to access it. But also on our website is an Access Accountancy guide. I think, Lorraine, one of your old application forms Jane shared with us, so I think we've kind of put that on there as a template for others to use. So it's a lot of information on the website. Any questions at all for any of the speakers today?
Can I just add, Sophie, that sorry, Laura,
Okay.
you were polite. As Lorraine has said, the timetable will develop over time, and you kind of tweak it and you get feedback, etc. So as Lorraine was talking, I've got my timetable in front of me and I've been adding things to it. And that's just how it goes. I mean, what you're trying to do is give them the breadth, isn't it? A breadth of experience of what it could be like working in NHS, particularly in finance. So don't get hung up on it. You know, it must be this and it must be that. You've only got them for a week, and a week goes really quickly. So just try and get them out there meeting people.
Laura?
Yeah, I mean, a question. I think we've had lots of questions previously, and as you process how might you do this in your own organization, I think there's questions that arise. I think, Lorraine, you made a really valid point. It is incredibly important to speak to the relevant school to think about the timing, and that will differ by school, it will differ by region. So I remember when we started it, I was taking a lot of inspiration from the National Audit Office, who run it in half term in October. Because being mindful that many students do need to work in half term, it is really helpful to have it in different times. And I think we moved to a summer time. But I think I would say step 1, find your engagement officer in your organization, talk to them about schools and find out what is a particularly helpful time. And just coming back on the presentation, I think Access Accountancy, again, the structure is enormously flexible. And if you think about that, it comes from the Big Four, people working at PwC or EY. The requirement is that students can't be asked to. We can't ask them to deliver client work, right? You can't put the pressure on them to actually do work. That's why it is more like a shadowing thing and an introduction. But it is mindful that really we should give CV enhancing experience, hence this requirement for the presentation at the very last day. And I think that is an incredibly important skill. As of course any of us progress, you're often asked to give a presentation, and that's one of those things which is actually really active work experience, being able to present to a senior group of people on something you've taken away. And while it's daunting, it is enormously important, and I would say is an important feature of that week. And I just wanted to add that.
Thank you. Oh, Jane?
Oh, yeah, hello. I mean, brilliant presentation. Thanks ever so much, everyone. And just interested in, I know we talked a lot about the technicalities and things like that, but it's also a really fun thing to do, isn't it? And I know you work incredibly hard, but it's really fun. What has been the most surprising thing that you've kind of come across in terms of either the questions or just something that, you know, assumed knowledge that you thought they'd have that they'd got no clue about?
I'll start if I may. So the thing that would always stick with me is the first time we ran it, and we ended the week, and we had 2 students, and they had done a fantastic presentation. And it was incredible. They could have been on television, and we're doing it together. And I couldn't believe how skilled they were, because they were, 70-year-old students. And we told them that, I think, oh my God, you're so ready to present. But they said the takeaway was they didn't realize we talked in millions. Right, we talk in millions, the size of budget we deal with, and I think that wasn't clear to them at all. And one of them then said her summary for the entire week was that it was so much better than half term, and I thought that stayed with me, and I thought that was wonderful, and that was really genuine from her. So that was a really wonderful thing, and it speaks to the fact it can be really fun, super interesting. And comes back to breadth of experience. So if you're able to do a tour, and we had estates, we had procurement, show the wider workings of a hospital where possible. And I appreciate, Lorraine, you saying you're in a regulator, but of course you're doing enormous amounts to show the breadth of the organizations involved in the region. It is fun, and it's I would like to think it's also inclusive. So if you have other students, other members of staff, I've always been very, very keen, as you know, Jane, that if we have active students, people or apprentices, to come along to some of these sessions, because it should be available to all of our staff. And if we have graduate placement students, they can come, they learn something. So it is I think it's a wonderful experience, and everybody gets something out of it.
I think the thing that really hits the spot, and Lorraine mentioned it a couple of times, is when you tell them about the benefits of working for the NHS. So particularly when you show a gender for change pay scale, it's amazing how they might not be listening too much, and all of a sudden their head snaps towards the page and they go, what the heck? I think, as Lorraine said, it's probably useful to get that out there to start with, because then they actually appreciate that there's a clear progression, and it's financially rewarding. I think that's useful, because especially, again, we had the same thing. People thought they were going to be working, finance is all about being an investment banker. So they might be surprised initially when you say, well, actually, we do all of these things. But when you then tell them, but actually the rewards are still, still very beneficial. That's always an eye opener. I think the other thing is and sorry, Lorraine, you've reminded me of this, so I hope I'm not stealing what you're going to say, is reminding them that it's not just about finance. So it is around, what do we do to support people with their well-being? What do you do around development? What do you do around people understanding who they are as a person? So a lot of the EDI stuff that we do, we were very fortunate that we had the away day, so they took part in that. We always have an EDI element on our away day, so they got involved in that and learned what sort of person they were, and how all types of person work within finance. That was really rewarding, and having a conversation with them afterwards about that. So don't make it necessarily everything about finance. Reminding them that finance is, we're just people.
Definitely. Thanks. Yeah, I was quite struck by how little they knew about NHS finance, and also how few people they knew that worked in the NHS. We've not had many people, obviously, but they really didn't know that many people that worked for the NHS. And also, it really makes you realise how much jargon we use, and you have to simplify your language, because we just talk in abbreviations the whole time and acronyms. So that was really really good to remind us all, and it's interesting what they find interesting, I guess. I think that's the key. But yeah, definitely rewarding. I absolutely adore this week, and it's very fulfilling for me. and I'm afforded the time and luxury of time to do it. And it's not expensive. It doesn't cost you much. It's just time, really. That's it from me.
Thank you. Are there any other questions from anyone about the programme? No, in which case, yes, just want to finish by saying, there is overwhelming evidence to show that those from lower socioeconomic backgrounds are less likely to be hired. So if we can do something that helps build their CVs, gives them some experience, and makes them think about the NHS as a career, then it'd be a fantastic thing to do. So thank you very much, Daryl, Laura, and Lorraine, for presenting today. Really appreciate it. We've got the session recorded and we've got the slides, and there's loads of information on the website, but please feel free to contact any of us if you've got any questions about it, and hopefully we can get this going in other regions as well.
Definitely. Thanks, Sophie.
Thank you. Thanks, everybody.
Brilliant. Thank you, everyone.
Bye.
Thank you. Bye.